Dr. Nancy Yoon with the Springfield-Greene County Health Department. I'm here today to answer some common questions about serology or antibody testing as it relates to COVID-19. The test used to diagnose a current COVID-19 infection is a PCR test. This is a genetic test for the presence of viral RNA from a nasopharyngeal or oropharyngeal swab. If a person tests positive, this means they have a current infection with COVID-19. Antibody or serology testing for COVID-19 is a blood test. It looks for antibodies, which form as part of the body's immune response to the virus. If a person has antibodies, it means they have been exposed at some point in the past to SARS-CoV-2, which is the virus that causes the COVID-19 disease. On average, it takes about 14 days for the IgG antibody to be detectable after someone is infected. There are many different companies that are offering antibody tests. The majority have not been FDA approved. The currently available tests have been authorized under emergency use authorization, and the tests vary widely in their performance. If a person has a positive antibody test, the CDC classifies this as a probable COVID-19 case rather than a confirmed case. This is because we don't have as much confidence in whether the test result is valid. There are also multiple different antibodies to various proteins on the surface of the virus. Not all of them are specific for COVID-19. A test could be positive if a person has been exposed to a different type of coronavirus, but not necessarily COVID-19. This is what we would call a false positive test or cross-reactivity. If the prevalence of COVID-19 in a community is low, a positive test result is more likely to be a false positive result rather than a true positive. It is also possible to have a false negative test if a person is tested too early in the course of their disease. It is important to understand the positive and negative predictive value of these lab tests in order to correctly interpret the results. Serology tests will be useful to determine the number of people in the population that have been exposed to SARS-CoV-2. At this time, we don't know if the antibodies provide protection or immunity from reinfection with COVID-19. We also don't know what level of antibodies are needed to provide protection and how long this protection will last. So we don't want people to have a false sense of security if they have a positive antibody test. We continue to learn more about the disease and the accuracy of the different types of lab tests available. In the future, we hope to have a better understanding of how to use the information in a more clinically useful way.